Hello everyone, so let's start with the first topic, difference between primary and permanent teeth. Primary teeth, they are 20 in number, premolars are absent. Permanent teeth are 32 in numbers and premolar are present. There is total of 4 premolar on each jaw, left and right side. That's a total of 8 premolars in the entire dentition. Now, the primary teeth, they develop from the dental lamina. Dental lamina is a band of thickened oral ectoderm. It is a band of thickened oral ectoderm which later gives rise to the tooth buds which form the developing tooth. Now, in case of the permanent teeth, the dental lamina continues to grow and it gives rise to two sides. One is the lingual extension and one is the distal extension. The lingual extension, this is towards the tongue, while the distal extension, this is towards the back of the tooth. Secondly, mamelons. Now, what are mamelons? Mamelons are small rounded extensions. Okay, they are small rounded extension present on the biting side of the newly formed or erupted tooth. Mamelons are absent in the primary dentition while they are present in the newly erupted tooth. That is mainly the permanent incisors. Okay, now the relation between the primary and the permanent is different. The relation between the upper and lower teeth is tooth to tooth relation or edge to edge contact in case of primary dentition, while it is an intercuspation relation in case of the permanent dentition. The mesodistal diameter of crown is more than their cervico-incisal length in primary teeth, and in permanent teeth the cervico-incisal length is more than their mesodistal dimension. When you compare the roots of the primary and the permanent teeth, you can see that the roots of the primary teeth are longer and more slender in comparison with the crown size, and they are conical in shape. There is absence of root trunk in primary teeth while the root trunk is prominent in the permanent teeth. You can see bifurcation and trifurcation in the molars of the permanent teeth. Roots of the primary teeth, they flare more as they approach the apices than the permanent molars, and the flaring of the roots is less in the permanent teeth. Dentoenamel junction is less scalloped in primary while it is scalloped with the convexities towards the pulp or the dentine in permanent teeth. Volume of pulp is larger in primary teeth while the tooth structure is less. While when you see it in the permanent teeth, the pulp volume is less and the tooth volume or the tooth structure is more in the permanent teeth. There is no marked cervical constriction between the pulp and the root canals, and there is marked constriction between the pulp chamber and the root canal in the secondary teeth. Area of periodontal ligament is less in primary dentition. Laminar dura is relatively thick, while in case of the secondary teeth or the permanent dentition, area of periodontal ligament is more and the laminar dura is relatively thin.